Good afternoon and salam alaikum, Honourable Vice President, colleagues, ladies and gentlemen. I'm making these comments, of course, as UN Resident Coordinator, but also UNFPA Rep, and it's my pleasure to be here today to launch this report, which I think is quite timely and quite interesting for the Maldives, as I hope that you'll see when you have a chance to look at the information pack which has been made available to you. And perhaps we can start even with some with some numbers. And these are numbers which are actually quite good for the Maldives. We've seen quite some progress over the last few years. Infant mortality rates have dropped from 63 deaths per 1,000 births in 1986 to 11 in 2009. A baby born today in the Maldives can expect to live until 74 years old, which is more than 20 years older than a baby born in 1980. The number of children a woman is expected on average to have here fell from about 7 in 1980 to 2.5 in 2009. It's important to look at why these gains have been possible. And it's quite a complex and interesting mix of social and cultural forces. Women's access to education, income earning opportunities and reproductive health care, including modern methods of planning, are important. But there are challenges now, I think, that we have to look at, which are related to the reality of a large and growing population in Maldivian terms. Of course, Maldives is a lot smaller than many other countries in population terms, but right now we're looking at Maldives reaching 400,000 population by around the year 2025. This doesn't have to be just a threat to the country, this is actually an opportunity. Above all, Maldives is entering the years now of what is called the demographic bonus, which means having a relatively large population of working age with a relatively low dependency ratio. So what that means is, in real life again, this is related to the fact that the average number of children that a woman had in 1990 was around 6.1 children. That's a very heavy burden for a family to look after. So again, the statistics. In 1990, there were 98.8 dependent population for every 100 population of working age. In 2006, there were only 56.9 dependent population for every 100 people of working age. This really offers an opportunity in many ways. It allows us to look at following particularly the Asian model, actually, where extraordinary advances in economic growth and social issues have been possible because of this demographic bonus. We see these rewards accruing both at individual and national levels. Now, Maldives, again, although it is a very large country in terms of how long and how far it takes to go from top to bottom, is also a very small country in terms of land density, which means that Maldives has very high population density. In fact, excluding city-states, the population density of Maldives is in the top 3 in the world, ahead even of Bangladesh. Malé itself as a city is one of the most densely populated cities in the world, perhaps even the most densely populated city, depending on how you look at things. This creates challenges related to space and environment, and again points us to why we need to be looking at the topic of the report which is before you today. I'm very glad that the report has come out with this kind of focus for the Maldives. I think it's highly relevant. I do hope you have a chance to look at it and to print it in your publications and carry it on your networks. But I think this is a time for the Maldives to start thinking about the messages in the report and look at how they can be applied to your context and your country. Thank you very much.
Bismillahirrahmanirrahim. UN Resident Representative Andrew, Your Excellencies, distinguished guests, ladies and gentlemen. Assalamu alaikum. A very good evening. Today, I stand here to speak on UNFPA State of the World Population Report 2012. The highlighted theme for the global launch is by choice, not by chance. Family planning, human rights, and development. As Andrew very clearly mentioned, we should all believe it is the right of women when to be pregnant. Globally, 1/4 of sexually active women aged 15 to 49, 222 million women, in all have an unmet need for family planning. The report argues for a right-based approach for family planning, enabling women to exercise their reproductive rights, including choosing when to become pregnant, enables other rights including health, education, and the achievement of a life with dignity. But the family is too big, the expenses too high. So without family planning, can we live to the standard we want? Certainly no. Every child needs a higher education. Every child needs to be brought up with respect and dignity. And today's high education for children is extremely essential. And as you must have seen recently with the reports achieved by the students in the Maldives, they are all achieving very high grades. If family planning is not practiced, how do you give your child the opportunity of a proper education? This is a question that every father, every mother should ask. And I certainly believe that it's a mother's choice. Certainly, every choice made by a couple, a family, a husband and wife, should be mutual. But as we all know, the hard part of bringing a child is always, most of the time, carried on by the mother. Since excessive population growth is an extremely serious problem facing the contemporary world, and with the world epidemic of overpopulation, UNFPA has played a major role in Maldives, creating awareness and making a difference. Like Andrew said, we have been successful. But the most important and most difficult thing is to sustain a success. We thought bringing democracy will be great. But how do you sustain a democracy? In the same manner, today we have achieved a success in family planning to some extent, but to sustain it is more important for economic reasons. UNFPA role in the Maldives, which started in 1980, changed the scope of institutional structure. Since 1994, UNFPA initiated 4 country programs which has benefited the Maldivian in many ways, many different ways, especially in family planning. When we say family planning, we must all know that it is not about birth control only. Family planning services are defined as educational, comprehensive, medical or social activities which enable individuals, including minors, to determine and to having children by choice and not by chance. Because family planning is not only a birth control measure, but also a human rights and development issue. Having children by choice, not by chance, eventually will pave way for a better future of the people as a whole. Unplanned family increases constraints more often on women and adolescents, and eventually welfare is not met properly. More importantly, this pressures future economic growth, and we do believe that economic growth is the success of a nation. For the many challenges faced with population growth, United Nations 1994 International Conference on Population Development and the 2000 Millennium Development Summit called for universal access to family planning, information and services. The question we do ask still today, is family planning access to all the islands? Is family planning properly taught and educated? Is education given to the people in the islands? This is a question that we have to answer today. The country program of Maldives recognizes the reproductive rights of women, men and young children, young people, especially of vulnerable populations, as well as the linkages between reproductive rights and goals of the ICPD program of action. The Beijing Platform for Action, the Convention on the Elimination of All Forms of Discrimination Against Women, and the Millennium Development Goals. This has paved way for many interventions of actions at different levels, and I should congratulate UNFPA for the hard work and commitment they are showing to keep things in the right direction. The pressure of the rapidly growing population will establish limits on future economic growth and the ability of the country to provide for the welfare of its citizens and to achieve its national development objectives. With family planning, it reduces the family size, would reduce public sector spending for basic requirements and reduce pressure on national resources. In Maldives, demography and health survey indicate 1 in every 4 pregnancies were unplanned, 16% unwanted and 10% mistimed. Further, Family Protection Unit at IGMH records show 33 women, average 23 years age, had out-of-wedlock pregnancies. As in the Maldives, the youth, the adolescents, have high levels of unintended pregnancies, due in part to poor access to contraceptive information and services. Worldwide, adolescents and youth account for some 40% of unsafe abortions. When we look at some population figures, it is very interesting to note that in the 1970s, couples worldwide had an average of 5 children per family. But today, they have an average of 2.5 children. In Maldives, average family size has declined from 6.4 in 1990 to 2.5 in 2009, which shows the impact of the work done by UNFPA and the implementing agencies. And again, I congratulate you all for the hard work that you have carried out. But that's what I meant. This is the time for us to make preparations and understand and continue to give information about contraceptives and other ways of methods and explain them to people on family planning. Family planning is a human right and helps in the development as a whole. So through education and prevention, increased contraceptive use has reduced maternal deaths by 40% by reducing unintended pregnancies. And 30% more maternal deaths could be prevented by fulfilling unmet need for family planning. So family planning should be by choice, not by chance, because family planning has accelerated the process of eradicating poverty, promoted the change of people's concepts regarding marriage, birth, and family, effectively checked the trend of over-rapid population growth, helped female productive forces, and helped improve status of women, especially in working women created favorable conditions for the development of country's economy and the improvement of people's living standards, promoted the improvement of the quality of the population in terms of education and health, as well as the overall development of the people. That's why I mentioned to you, economically it's very important. And we have heard many times that in the Maldives today, a husband and a wife needs to work so that you can have proper education given to the children, especially for sending for higher educations. As I said, populous development is like a pandemic to the world. So when the UN Population Fund sounded a warning to the international community, survival and development of the nation alerted and attention highlighted to bring a balance between consumption and development. Because it is projected that the world population would be 12.5 billion people by the middle of the next century, and probably the humanity be unable to develop further. So therefore, it is important for this small nation also to understand how do we sustain our economic development. Therefore, policymakers must think through both the short and long-term consequences of policies prior to implementation. Importantly, governments and non-governmental organizations in the Islamic countries should be active partners, and religion should not be considered as a barrier in this endeavor. Muslim countries and societies are no different than the rest of the world when they aspire to reach their development goals by improving the health of their women and children. We are all human beings, irrespective of what religion and what belief we have. I give assurance that the government will be a part of the change and development. For a prosperous future, for family planning, for a prosperous future, family planning is a must. To make Maldives the place of choice for healthy families, stable societies, and to live, to work, and to do business, we have to have family planning and give that choice to the women. And I strongly say that because I sincerely believe it is a choice that women must have a right to make. I wish you all a success, and may God bless the Maldives. Thank you.